When you hear the word arthritis, you might instantly picture aging joints, perhaps an elderly person rubbing their knees or wincing as they stand up. It's a common image, and for many, arthritis is simply seen as a natural part of getting older, a result of years of movement and use. But that's only part of the story. Arthritis doesn't just affect seniors, it can impact people of all ages, including young adults and even children. The reality is, joint pain and swelling can have many causes, and not all of them are related to the simple passage of time. Not all joint pain is from simple wear and tear. Some forms, like rheumatoid arthritis, or RA, are far more complex and can be misunderstood. Unlike osteoarthritis, which is mostly due to the gradual breakdown of cartilage, RA is a different story altogether. RA is an autoimmune disease, which means the body's own defense system, designed to protect us from illness, mistakenly turns against healthy joint tissue. Instead of fighting off infections, the immune system attacks the lining of the joints, causing pain, swelling, and damage. This isn't about joints simply wearing out over time. It's an active, ongoing, inflammatory process that can strike at any age. The inflammation can be severe, leading to redness, warmth, and swelling that can make even simple tasks difficult. The pain and swelling of RA are signs of an internal battle, not just aging. It's your immune system in overdrive, and the effects can be both physically and emotionally challenging. Recognizing this difference is crucial for getting the right diagnosis and treatment. Early detection and intervention can make a world of difference, helping to prevent long-term joint damage and preserve mobility. Understanding RA empowers people to seek help, ask questions, and take control of their health journey. Knowledge is the first step toward effective management and a better quality of life. With modern medicine, RA can be managed. Treatments can reduce inflammation, prevent joint damage, and help people maintain their independence in daily routines. The story of RA is about resilience, scientific progress, and understanding what's really happening inside your body. By learning more, you can face RA with hope and confidence. Rheumatoid arthritis, often called RA, is a chronic autoimmune disease that affects millions of people worldwide. Unlike some other forms of arthritis, which are caused by wear and tear, RA is the result of your immune system mistakenly attacking your own body's tissues. In RA, your immune system, which normally protects you from infections, becomes confused and targets healthy tissue by mistake, especially in your joints. The main target is the synovium, a thin membrane that lines the inside of your joints and produces lubricating fluid to help them move smoothly. When the immune system attacks, the synovium becomes inflamed, swollen, and thickened. This inflammation can make joints feel warm and tender to the touch. As a result, people with RA often experience pain, swelling, and stiffness in their joints, especially in the hands, wrists, and knees. These symptoms are often worse in the morning or after periods of inactivity. The inflammation in RA is ongoing and persistent, not just a one-time flare-up. It can last for months or even years if not properly managed. Over time, this chronic inflammation can erode cartilage and bone within the joint, leading to permanent joint damage, deformity, and loss of function. This is why RA is considered a progressive disease. Early diagnosis and treatment are crucial. Starting therapy as soon as possible can help slow the progression of the disease and prevent long-term disability. RA is a systemic condition, meaning it can affect more than just your joints. It may also involve organs such as the skin, eyes, lungs, and heart, leading to a wide range of symptoms. That's why people with RA may experience fatigue, low-grade fevers, weight loss, or a general feeling of being unwell, even when joint pain is not severe. RA is much more than just joint pain. It's a complex, whole-body disease that can impact daily life in many ways. Understanding RA is the first step toward managing it effectively. RA, or rheumatoid arthritis, and osteoarthritis, often called OA, are two of the most common causes of joint pain, but they're actually very different conditions with unique causes, symptoms, and treatments. Understanding these differences is crucial for patients and their families. Osteoarthritis is known as the wear and tear arthritis. It usually develops gradually as people age, or after repeated stress or injury to a joint. OA most often affects larger, weight-bearing joints like the knees, hips, and spine, making everyday movements like walking or climbing stairs more difficult over time. In contrast, Rheumatoid arthritis is an autoimmune disease, which means the body's immune system mistakenly attacks its own joint tissues. RA can begin at any age, even in young adults or children, and it often starts in the smaller joints, such as those in the hands, wrists, and feet. One key difference is how these diseases affect the body. RA typically causes symmetrical joint involvement, meaning the same joints on both sides of the body are affected. OA, on the other hand, is more likely to impact joints on just one side, especially if it's related to an old injury or overuse. The pattern of pain is also different. OA pain tends to worsen with activity and improve with rest, so people may feel better after sitting down. RA pain, however, is often worst in the morning or after periods of inactivity, with stiffness that can last an hour or more before easing up. In RA, joints are usually warm, swollen, and tender because of ongoing inflammation. This swelling can lead to visible changes in joint shape and function over time, making it harder to use the hands or walk comfortably. Unlike OA, RA is a systemic disease, which means it can affect the whole body. People with RA may experience fatigue, low-grade fevers, and even unintentional weight loss. These symptoms are signs that inflammation is affecting more than just the joints. RA can also cause inflammation in organs like the heart, lungs, or eyes, leading to complications beyond joint pain. Osteoarthritis, by contrast, is limited to the joints and does not cause these widespread symptoms. Recognizing these differences is essential for getting the right diagnosis and starting the most effective treatment. Doctors use a combination of medical history, physical exams, and sometimes blood tests or imaging to tell RA and OA apart. Early identification of RA is especially important because starting treatment quickly can help prevent joint damage and improve long-term outcomes. OA management focuses on relieving pain and maintaining joint function. By understanding the distinction between RA and OA, patients and doctors can work together to choose the right therapies and take action early, leading to better health and quality of life. RA's joint pain is just the beginning. Swelling, tenderness, and morning stiffness can make daily tasks difficult, but RA's impact goes beyond joints. Chronic inflammation affects the whole body. Fatigue is common and can be overwhelming, not relieved by rest. Other symptoms include low-grade fever, loss of appetite, and unintentional weight loss. About 40% of people with RA have symptoms outside the joints, like dry eyes, dry mouth, or firm lumps under the skin. Inflammation can even affect the heart, lungs, and blood vessels. RA must be treated as a whole-body disease, not just a joint problem. The exact cause of RA remains unknown, but it's likely a mix of genetics and environmental triggers. Genetics play a role. Having a family member with RA increases your risk. Certain genes make the immune system more likely to attack the body's own tissues. But genes alone aren't enough. Many with risk genes never develop RA. Environmental triggers like smoking are major risk factors and can worsen the disease. Some infections may also trigger RA in genetically susceptible people. Hormonal changes and even physical or emotional trauma are being studied as possible contributors. RA likely develops when genetic predisposition meets one or more environmental triggers. It's a complex, multi-step process, not a single cause. Diagnosing RA isn't simple. There's no single test. Doctors start with a detailed history and physical exam, looking for patterns like symmetrical joint involvement and signs of inflammation. Blood tests check for inflammation, like ESR and CRP, and specific antibodies. Rheumatoid factor, anti-CCP. Positive antibodies strongly suggest RA, but not everyone with RA has them. Imaging, X-rays, MRI, or ultrasound can reveal joint damage or early inflammation. Early in the disease, imaging may look normal, so diagnosis relies on the whole clinical picture. Doctors piece together symptoms, exam findings, blood tests, and imaging to confirm RA. Early diagnosis is crucial for starting treatment before damage occurs. If you have persistent joint pain and swelling, see a doctor promptly. The sooner RA is identified, the better the outcome. Treating RA means more than just easing pain. It's about stopping the disease in its tracks. The mainstay is DMARDs like methotrexate, which suppress the immune system and slow disease progression. Biologics, a newer class of drugs, target specific parts of the immune system and can be life-changing for many. NSAIDs and corticosteroids help manage symptoms but don't prevent joint damage. Physical and occupational therapy are essential for maintaining mobility and independence. Therapists teach exercises, joint protection, and daily strategies to reduce stress on joints. Lifestyle changes, healthy diet, stress management, and quitting smoking support medical treatment. Treatment is individualized and may change over time. The goal: control inflammation, prevent damage, and preserve quality of life. In RA, early treatment is critical. There's a window of opportunity to change the disease's course. Starting DMARDs or biologics early can prevent irreversible joint damage and disability. Once cartilage and bone are destroyed, the damage is permanent. Early intervention means less pain, better function, and improved quality of life. Don't wait for severe symptoms. Seek help if you have persistent joint pain and swelling. Doctors now act quickly, aiming for remission or low disease activity as soon as possible. The sooner treatment begins, the better the long-term outcome. Early action gives people with RA the best chance to stay active and independent. A diagnosis of RA can be daunting, but today's treatments offer real hope. Many people achieve remission and live full, active lives. Success depends on a strong partnership with your healthcare team and staying engaged in your care. Adjusting treatment as needed and reporting new symptoms helps keep RA under control. Exercise, healthy eating, stress management, and rest all support your well-being. Learning about RA empowers you to make informed decisions and advocate for yourself. RA is a challenge, but it doesn't have to define you. With early diagnosis, proactive care, and self-management, you can take control and live the life you want.